So drug ads are carefully constructed to use both the power of numbers and the power of stories to sell their product. So let's look at how it's done. Numbers are framed in the most positive way. For example, a statin advertisement would say that your risk of a heart attack is reduced by 30%, but it's not, they won't say that it's 30% of 1% or 2%. So I'd like you to look at this next slide, which has an ad for a new medication called Pradaxa. Dabigatran is the generic name for it. And this is a medication that was recently approved to treat patients with atrial fibrillation, an abnormal heart rhythm. And this ad came from an internet site for patients. So you see the doctor there, and he's giving the patient the information. And this ad uses numbers very effectively. So it first states that if you have atrial fibrillation, you are up to 5 times more likely to have a stroke. Now, 5 times, this sounds very threatening, clearly implies that you need treatment. But what are the real numbers? What is the baseline risk for atrial fibrillation if you're not treated? So many of you in this audience might know that this depends on what's called a CHAD score, whether or not you have heart failure, high blood pressure, diabetes, your age, and whether or not you've had a prior stroke or other neurological event. And that number varies between 0.5% and 6% for ambulatory patients. So now let's frame those numbers in the opposite way. Between 94% and 99.5% of patients will not have a stroke without any treatment. So obviously these are much less impressive sounding numbers than 5 times increased of risk. So now the ad goes on to say that this new treatment is 35% better than the traditional treatment, which is warfarin. So this also sounds very impressive. But again, what are the actual numbers? So the risk of stroke in the RELY trial, which was the clinical trial used to approve this medication, the risk of stroke was 1.7% with warfarin, the traditional treatment, and 1.1% with the new treatment, a difference of 0.6%. And I think you can all imagine that if I reconfigured this advertisement to say that the new treatment was 0.6% better than the old treatment, you'd be a lot less impressed. So it turns out that when patients hear the numbers the way they're stated in drug advertisements, a study from Dartmouth showed that they typically think their medication is 10 times more effective than it is. Now, this is not just a problem for patients and drug advertisements. It's also a problem for doctors and those of you who are reading clinical studies.